Coffee enemas. When I first heard about that, I thought it was the weirdest thing that I had could ever conceive of. But what I found when I actually gave them a try was that they made me feel a lot better. So that persuaded me to continue to do them. And then when I looked a little bit more at the medical literature, I found there's a long history of people using coffee enemas. There are two practitioners that are well known for recommending them. Dr. Max Gerson and Dr. William Donald Kelly, but neither one of them actually invented coffee enemas. When I looked a bit more in the medical literature, I found references going back to the mid 1800s where doctors were using them in the treatment of poisoning or in postoperative care. As an example, one article from 1896 described a lecture where one of the Mayo brothers, who started the Mayo Clinic, recommended them very highly for postoperative care. Another article by a doctor in Uruguay in 1941 talked about his experience using them in postoperative care, but also in cases of poisoning or in shock. He found them extremely effective, and he recommended strongly that they be continued to be used. But what happened in the 1940s, 1950s, as pharmacology came along and various medications came into existence to treat various types of issues, people gradually got away from the use of things like coffee enemas. It wasn't that they were ever proved to be ineffective, they were just considered to be old-fashioned, not what we current knowledgeable medical doctors do, and they got put on the back burner or even taken off the stove altogether, so to speak. But various practitioners have continued to use them and found them effective. In the work that I do, which involves nutritional protocols as well as detoxification with coffee enemas, I find them invaluable. And so they're a critical part of the program I do. And if you're not currently on my website, if you're watching this on YouTube or on some other website, I hope that you'll come and check out my own website, subscribe to my email list, and learn more about the history of coffee enemas. How do they work? Well, I can't say that their mechanism of action has been extensively studied because, like I said, they got put on the back burner 50 or 60 years ago. But some researchers in Korea actually did a study where they looked at the use of coffee enemas around a procedure known as capsule endoscopy. What's capsule endoscopy? Well, that's where you swallow a little capsule that has a camera in it, and it travels through the intestinal tract, looking at the inside where an endoscope or a colonoscope can't go. And what happens many times with this capsule endoscopy is that as the capsule goes past the liver, the gallbladder, the bile duct, those areas release bile and it clogs up the picture, so you can't see as well from this little camera. What these investigators did, trying to figure out if coffee enemas stimulated bile flow, was they took a group of people that were going to have this procedure anyway. Half of them did a coffee enema before they swallowed the capsule, the other half did not. And what they found was that the group that did the coffee enema before they swallowed the capsule, those people did not have that release of bile. Presumably what had happened was that the coffee enema stimulated bile flow before they swallowed the camera. So then when the camera went by, it couldn't stimulate bile flow because there wasn't any more bile to flow right at that moment. So this would suggest a mechanism of action that many people have maintained all along since the 1920s, that coffee enemas stimulate the liver to get rid of bile. Bile is where the liver gets rid of waste materials, and so stimulating that bile flow can help the liver detoxify the body better. Regardless of the mechanism of action, what we find is that coffee enemas make people feel better, and that is sufficient for our patients who try them to continue to do them. In fact, no one ever believes us when they first come in, but I routinely hear from patients that the coffee enemas have become their favorite part of the protocol that I offer.